Hi, welcome back to my channel. In this video, I will be talking about mandibular rotation. So this is like a very confusing and a difficult topic because every rotation has a different concept for a different author. But there's just one table that you need to be thorough with that I'll draw in this video, and most of the questions will get solved through that one. So first of all, there are around, if we see, we just need to know 5 things in mandibular rotations, and that will solve all the problems. So first of all, suppose if your posterior growth is more than the anterior. Second, it can be anterior growth more than the posterior. Then third is rotation of mandibular core with respect to cranial base. Okay, I'm just writing what all parameters we will talk about. Then rotation of mandibular plane with respect to cranial base. Then last one, rotation of mandibular plane with respect to mandibular core. Now here I want you to know that mandibular core is something that is the bone that surrounds inferior alveolar nerve. Alright, now listen to me nicely after this, because now it's going to get serious. So see, if you have posterior growth more than anterior growth, so we'll just draw a line so that it's neat and clean and I don't confuse you. And sorry, it's just God, yeah, and I think we need one more. Yep. So see, if you have posterior growth more than the anterior growth, so here I'll just write the names of authors: Solo, Austin, and Profit. All right, so yeah, so if you have posterior growth more than anterior, this is what is called as forward rotation. Okay, and the opposite of it, obviously, we'll call it as backward rotation. So you need to remember this. Okay, just remember ki just a basic way, don't get confused. See, A, B. Okay, so A, B. So anterior growth is more, so backward. Then let's talk about the ones that are confusing. So first of all, it's very easy. See, you have mandibular core with respect to cranial base. So what Bjork did was, he thought that mandibular core is something which is the main thing. So in his view, the rotation of mandibular core, so he thinks that mandibular core is something which is my main aspect, and I'm going to compare them all through this. So he took mandibular core as the main, so he just called it as total rotation. Okay, fine. Whereas then he thought about mandibular plane also. Then mandibular plane is something which is present, which is made by the mandibular core, right? So he called it as matrix rotation. And see, mandibular plane and mandibular core, like they are comparing it with internally. So just think of it as intramatrix. Okay. Then Solo and Houston. Now this is easier, relatively very easy to understand. See, he also he also went through same lines of Bjork. See, he also considered the mandibular core as the main thing. So obviously, if he's considering the mandibular core as main thing, so he will think that the rotation of the mandibular core along with the cranial base would be a true rotation, and of mandibular plane would be an apparent rotation. And in case you don't remember this apparent rotation, just remember this one. See, if he is comparing metaphorically, if he's comparing mandibular plane to mandibular core, so obviously he's just looking at the angular remodeling of lower border, right? So you can think of it in this way. Then the last one which is left is the Profit edition. Now Profit had some other views. He thought that no, I'm not going to consider mandibular core as my main thing. I'm going to consider the mandibular plane as the main thing. See, P for Profit, P for plane. So mandibular plane with respect to cranial base is what was total rotation for Profit. Okay, just think of it in this way. Then he said that obviously if you're comparing the core to the cranial base in terms of profit, then obviously you are just doing the comparison of an internal rotation, and if you're comparing a mandibular plane to the mandibular core, then you are doing an external rotation, like you're seeing external rotation, right? Now there are formulas that you should know about them. So first of all is according to the Bjork. So obviously total rotation is matrix plus intramatrix. Then according to the Solo and Houston, the total rotation is apparent plus angular remodeling, right? And according to Profit, the total rotation is internal rotation minus external rotation. This one is opposite, so this one is what you need to remember. Now we just can't leave this forward rotation and backward rotation without like touching it, right? Because obviously there might be something to it also. So see, according to Bjork, you had a forward rotation and a backward rotation. Forward and you had a backward. Now as I told you, in backward, what you have to remember is that you have anterior growth more than the posterior growth. All right, and opposite and forward AB, right? Then he then changed he classified them into further types based on the center of rotation. Now based on center of rotation, now you have to remember where the center of rotation lies for each one. So you have type 1, 2, 3, 3 types in forward and just 2 types in backward. See, in the first one it lies at the condyle of TMJ, then incisal edges of mandibular teeth and center of premolars. Okay, so CIC, or you can remember as CIP, up to you. Then like you can remember Cipla, right? So then here first is always with respect to the condyle only. So this is with respect to condyle of TMJ, and to backward it is most distally occluding molar. Now there's just one MCQ, like there are many MCQs, but like these are the core ones that you know, that you should know. Then there is this one MCQ with the, see, usually there's a rotation of 15 degree, and this 15 degree rotation leads to a 3 degree decrease in the mandibular plane. This is something which is a factual data and you have to remember it because it is an MCQ impulse. So yeah, so we'll just go through it once again so that like we can know that we've not forgotten things. See, first of all, posterior growth more than anterior is forward growth. Then I told you that forward growth has further 3 types, remember? So 3 types we knew Cipla. So center of condyle, incisal edges of the mandibular incisor and the center of the premolars. LA is nothing. Then let's talk about the backward growth. Now in backward growth I told you that you just have 2 types. One is the see, just consider the condyle and the distal occluding molar. Then according to Bjork, he considered that the mandibular core is everything, and Solo also did the same. So what they did was ki total rotation was given by Bjork for mandibular core, and then he said ki mandibular plane is something which I'm talking about the matrix. And see, you can just remember, if you forget, like I'm just telling you a trick. See, if it's a single M, then it's matrix. If you have 2 M's, like mandibular plane and mandibular core, so obviously you're doing it internally, right? So intramatrix. Then Solo and Houston also considered mandibular core as the main thing. So obviously this was true rotation. And mandibular plane to mandibular core is metaphorically also, like if you can relate to the name only, it is the angular remodeling of the lower border. And if you talk about the mandibular plane with respect to cranial base, only one thing that is left is apparent rotation. Then Profit was someone who thought, no, and I'll not consider the mandibular core as the main thing, I'll consider the mandibular plane. So P for Profit, P for plane. He said mandibular plane is something which is going to define my total rotation. So he gave the total rotation in context to the mandibular plane rotation with respect to the cranial base. Then he said that core is something which is internal, right? Like think about it. Then he thought that core is internal, so internal rotation. Then mandibular plane with respect to mandibular core is external. Then these were the formulas. Everything has a plus in total rotation, like matrix, intramatrix, and so on. But in Profit, you have to to subtract it. Okay, then this I told you, this is we can talk about it as Cipla, and this you have to like remember. You can remember Cipla CM, but like just go through it twice and you will not forget. And this was something which was factual question, that there's a 15-degree rotation and it leads to a 3-degree decrease in the mandibular plane. So this is the core of mandibular rotations in a very short format. If you found this video helpful, do give it a like, and you can share and subscribe. Yeah, and okay, and I'll just put some questions so that you can think, you can like understand if you've got it or not. So you can reply them in the comments if you want to. So if I ask you forward and backward rotation term given by, so just tell me in the comments. And second question is the difference between total and matrix rotation by Bjork is what, and it represents which rotation in Solo and Houston's terminologies. Okay, then yeah, and you have to remember that sometimes we call mandibular core also as corpus. Okay, yep. So this is all about it. If you found this video helpful, do give it a like and share, subscribe, and thanks for watching.